Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Shamimi binti Muhammad. My case number is 209976. My selected issue is drug addiction among teenagers. So I'll move on to the first slide, which is my mind map about drug addiction among teenagers. The background of the drug addiction is many teenagers regard drug and alcohol experimentation as a crucial part of growing up, despite the substantial risks and numerous negative repercussions. Some teenagers are first exposed to drugs through prescriptions and subsequently progress to recreational use. Some teenagers begin experimenting with drugs as a consequence of peer pressure or after hearing a song about drug misuse. Some even get their hands on drugs by robbing their parents' medicine cabinets. Teenage drug addiction is a very real concern regardless of how an adolescent first begins abusing substances. So there are a lot of causes from drug addiction among teenagers. The first cause is lack of education. Some adolescents and young adults grow up thinking drug and alcohol use is normal. Their favorite musicians are singing about it, the movies are glamorizing it, the TV ads are selling it. Whether you are sad, can't sleep, or have a headache, there is a drug for you. Our culture has adopted that pill cures all mentality, leading our youth to feel the same about drugs. Many do not understand the consequences of drug use. Many teens do not know how it can harm their minds, bodies, and relationships. They need proper education. They need someone to tell them the truth about how drugs and alcohol. The next cause is experimentation. The teenager's brain does not finish developing until the age of 25. The last part of the brain to develop is the one that controls the rational decision-making, self-control, and judgment, making adolescents more prone to trying risky and daring activities. Drugs and alcohol are often easy, accessible outlets for experimentation that can severely impact the developing teenage brain. The third cause is to feel better. There is the desire to feel good and there is the need to feel better. These are two very distinct entities when evaluating teen drug use. Teens looking to feel better are in truth self-medicating. They are battling something deeper than peer pressure or a failed home assignment. Some adolescents are suffering from deep-seated conditions like depression, social anxiety, and stress-related disorders. They use drugs to forget or replace their negative feelings with substance-induced pleasure. Next is competition. The need to perform to impress and to make proud is a great pressure for adolescents and young adults. Whether in school or on the field, young people consistently want to prove they are the best to their peers and parents. The competition to be outstanding, however, can be intense. In academic, for example, teens and young adults often rely on the misuse of prescription stimulants as smart drugs or study aids to improve academic performance. And the last one is peer influence. Some teens young adults are stuck amongst this bad cycle. At such a young age, they are more vulnerable to developing dependence and addiction. They get in over their heads at an early age and do not know how to get up. And next, I'll move on to the effects. Effects of drug addiction among teenagers are divided into two small effects, which is short-term effects and long-term effects. So from short-term effects, the teenagers that addict of the drug will change in appetites, will having a change in appetite, sleeplessness or insomnia, increased heart rate, slurred speech, and changes in cognitive ability. While in long-term effects, the teenagers will have a depression, anxiety, panic disorders, increased aggression, and hallucinations. So there are a lot of solutions to this drug addiction among this. So one of it is surround ourselves with supportive people, find a new hobbies such as reading, playing football, and playing games. Third, exercise, eat well, talk it out to our nearest friend, and seek for professional help. Next slide, which is additional model of outer and inner forces. According to the textbook, the inner and outer forces paradigm paradigm explains why people seem to act strange and unpredictable in certain situations. Inner and outer forces model shows that there are forces developed both within the person and from the person's environment that cause him or her to behave in certain ways. The inner and outer forces can be divided into three, which are micro, meso, and macro. So from inner forces, it can be divided into micro. Micro-level conceptualization will have to deal with individual and personal issues, including demographic of gender and age, and the circumstances associated with those. For example, adolescent psychological changes, which are the way they are thinking of their surrounding and others. Next, lack of love from their parents, and they does not get enough attention and care from them. And lastly, urge to know something more deeper. So this make them to get excited to know more about drug. So now I will move on to the outer forces. It can be divided into meso and micro. For meso, at the meso level conceptualization, adolescents are interacting with a large number of influences that can impact the adolescent life cycle and development. So some of these influences include families, schools, peer groups, religious organizations, and community organizations. So I will take, for example, peer influence. So peer influence could be the bad surrounding or circle among the teenagers are attracting them to get attached to the drug. Next, parental neglect also be the factor or effect why teenagers tend toward drugs. Next, macro level. Macro level conceptualization can have an impact on adolescents and their development and functioning within their environment. So macro level influences can include laws, enforcement, and school system that involve education and co-curriculum or teenage curfew. Discrimination and prejudice can impact minorities and marginalized population, and school policies can impact school involvement and performance. So lastly, I move on to the attachment, which is newspaper cutting. This is the video of the teenagers that involved in the drug addiction. So the newspaper cutting tells us all about how this teenager could involve in drug at an early age, which was from 30 years old until 16 years old, and who was influencing him to get attached to it. So that's all from me. Thank you.